Assalamualaikum, my name is Aina Tuladia. This is an oral presentation for reflective assignment. This slide is introduce the importance of the reflective practice in nursing. Reflective practice is essential because it is, helps nurses to continuously improve their professional skill, develop critical thinking, and also provide safe, effective, and patient-centered care. In high acuity settings such as ICU and or HDO, nurses are required to manage multiple patients with a different level of the dependency. This situation demands strong prioritization skill, especially when working under the pressure. One of the major concerns is the healthcare is a patient safety. Common issues include like a patient falls and delay in treatment, which are considered a preventable causes of harm, as highlighted by WHO in 2021. And the patient issue with the falls can occur due to multiple risk factors such as the visual impairment, psychological condition, and treatment are related to the factors. At the same time, delay in the care, such as the transferring patient to the operating rooms, can negatively affect patient outcome and disrupt continuity of care. Therefore, this is a reflection focus on how nurses can balance patient safety and timely care delivered. To guide this reflection, I am using the Gibbs reflective cycle, which provide a structure approach to analyze the clinical experience and approve future practice. Okay, moving on to description of my clinical experience. During my clinical placement in high dependency unit, I was managing patients with high acuity conditions who required close monitoring and complex nursing care. One of my patients was identified as a high risk for the falls due to significant visual impairment. The patient had one artificial eye and limited vision in the other's eye. In addition, the patient was on fasting and insulin therapy, which increased the risk of the hypoglycemia, further contributing to the risk of the fall. At the same time, this patient was scheduled for a procedure and needed to be transferred to the operating room. However, during the shift, I was responsible for the other critically ill patients who required urgent intervention due to unstable conditions. Because of this competing priorities, there was a delay in preparing and transferring the patient to the operating room. This situation required me to continuously balance between the ensuring patient safety, particularly for prevention, and managing time-sensitive care in high-pressure clinical environment. Okay, now we move to the slide for the feelings. How I was feeling this situation on that time. There is this situation, I feel concerned about the patient safety, particularly the high risk of fall. But at the same time, I feel stress and overwhelmed due to the heavy workload and also competing priorities. I also the experience uncertainty in my decisions making as I had to balance between the urgent and planned care. However, this situation also made me more aware of my professional responsibility and also the accountability in ensuring patient safety and delivering timely care. For the evaluation, in evaluating this experience, one positive aspect was that I successfully identified the patient as high risk of fall and implemented a preventive measure to ensure the safety. I also prioritized critically unstable patient appropriately, which align with clinical guidelines in high acuity setting. However, a limitation was the delay in transferring the patient to the operating room, which may have affected the continuity and timeless of the care. This is indicate that while my prioritization of life-threatening condition was appropriate, I still need to improve in time management, coordination, and delegation skill. So we go to the analysis. This situation highlight the complexity of the nursing practice in high equity setting, where multiple competing demands must be balanced, and then also the fall risk is multifactorial and requires continuous assessment, especially in patients with the visual impairment and treatment related to risk such as insulin therapy. From a clinical perspective, prioritizing the unstable patient was appropriate. However, patient safety also includes timely intervention, and the delay in transfer show a gap between the urgent care and also the planned care. This scenario also emphasizes the importance of communications, teamwork, and delegation. Effective coordination with the multidisciplinary team could have the help reduce delay while the maintaining patient safety. Now, as a conclusion, this experience has changed my understanding of the prioritization in nursing. I have learned that prioritization is not only about the managing immediate life-threatening condition, but also ensuring timely care and preventing potential risks such as falls. This reflection has helped me to adopt a more holistic and proactive approach to patient care. It also strengthened my awareness of the accountability and professional responsibility in clinical decisions making. For the action plan, I plan to improve my time management and also prioritization skill by being more organized and at the beginning of the each shift, including performing comprehensive patients and assessment and planning care accordingly. I will also implement early and consistent fall prevention strategy for the high risk patients. In addition, I will strengthen my communication and teamwork by informing the multidisciplinary team early, seeking help when needed, and I will also improve my delegation skill to ensure the tasks such as the patient preparation and transfer are completed on time. Lastly, I will continue engaging in reflective practice and lifelong learning to enhance my clinical reasoning and decision making skill. Through these strategies, I'm to provide more safe, timely, and patient-centered care in the future.